Just a disturbing new projection from a research group at the University of Washington. It shows Utah is on track to double its statewide death count in less than 10 weeks.
Fox 13's Diego Romo spoke with researchers about that projection and what we can do now to hopefully avoid that number.
We are projecting for your state that the cases will go up in winter because of the seasonality of COVID-19. We're moving indoors, and the virus loves indoors.
Doctors here in Utah say that projection is accurate if we maintain our current weekly case rates.
What we do know for certain, the fewer sick people, the fewer the deaths. And that's true for everything, not just for COVID.
Projections made by the Institute for Health Metrics and Evaluation show Utah passing the 2,000 death mark by February 17th. With a rapid vaccine rollout, that number could be held to just under 2,000 deaths. And if 95% of all people stick to wearing masks, deaths would be held to just over 1,700.
IHME models are a model, right? They're not a prediction of the future. We can actually control our future a little bit in how we behave as the public.
It's not written on our foreheads. We can prevent this. We can do our part to limit the transmission of the virus, especially around the holidays.
According to the data, the best prevention so far is wearing masks. This is clear if you look at their projections for deaths by April. On our current path, IHME projects over 2,500 deaths by April 1st. With 95% mask compliance, that number would be reduced by nearly 500 deaths.
So that means 1/3 of the deaths could be prevented from now on. It's just simply by wearing a mask.
Although there is hope on the horizon with a COVID-19 vaccine,
all of those measures that we've been recommending for the last 10 months, and particularly in the last 3-4 months, will still apply, and we have to continue to do those even after you get the vaccine.
Dr. Vento said although the models can be scary, they are not meant to spread fear.
You can be scared by it or not. The fact is, it's just the reality based on the data that we've seen and what they predict.
Both doctors from the University of Utah and Intermountain say the biggest takeaway should be that these grim projections can be avoided. All that needs to be done is to continue wearing masks and maintain social distancing whenever possible. In Murray, Diego Romo, Fox 13 News, Utah.